describe the nursing workforce: undervalued, underfunded, underpaid and underestimated. Since 2010 we have had a savage pay restraint inflicted on us at the hands of this government. Our nurses and NHS staff have lost 14% in real terms pay. Since 2010, chronic underfunding, cuts that run deep into our NHS, loss of beds and services have left our patients sadly dying on trolleys, care being rationed, our patients living in pain as there are no beds for them to have surgery. Jeremy Hunt, you make these cuts and you hurt our patients, and we nurses, we bleed. Since 2015, the government cut the NHS bursaries for nursing, midwifery and associated healthcare professional students. Despite clear warnings from both trade unions, frontline staff and students on how this would deter people from entering the NHS professions, the government did not listen. And what happened? We're now down 23% in applicants. In a nursing workforce which is 24,000 short, a nursing workforce with 40% of nurses heading into retirement, a nursing workforce which applications from the EU are down 90%. Jeremy Hunt, this is a very dangerous risk. Our student nurses should be nurtured and they are worth every penny. The government makes their pay offer to us, and I say to them on Wednesday that it's time the government valued nurses and NHS staff by lifting the 1% cap. We give 100%, but we only get 1%. Our nurses are finding it a struggle to put food on the table. Some resort into food banks just to be able to get by and to feed their children. Gabriella, RCN member, says, I apply for food parcels for my patients while at the same time wishing I could have one for my own family. Our nurses have been pushed to breaking point both mentally and physically, working extreme hours just to pay their rent. An anonymous RCN member says, if I sound irritable, it's because I'm on my 9th shift in a row. Our nurses have been pushed into a financial black hole. Cashflow, a payday loan company, said that last year 11% of their applications were for nurses. This is a disgrace. We may be underpaid, we may be undervalued, and we may be underfunded, but we are not to be underestimated because we count.